Hi, and welcome back to the video. In part two, we're going to be discussing how this problem occurs. The answer to that question is chronic inflammation. Chronic inflammation inside our bodies is what ultimately makes us feel sick. Chronic inflammation inside our body also damages different tissues and organs, and when these organs or tissues get damaged, it's going to alter normal function. And this is what causes symptomatology. So my question to you at this point in time is, what's better, treating the symptoms, the pain, the headaches, the stomach problems, the dizziness, or actually treating the underlying cause of the problem? Hopefully your answer is treat the underlying cause, because that's what this video is really about. If you merely just treat symptoms, you're never going to get better. The inflammation is going to continue to spiral out of control, and it's ultimately going to deteriorate your health, and it's going to impact the quality of your life. So to get better, to truly get better and feel better and function better, you have to address the underlying cause of the problem, which is inflammation. So, like I said, inflammation inside the body will cause damage and deterioration to any tissue. Simplest example I can give you is arthritis. If you damage a joint or you repetitively strain a joint, the joint's going to get inflamed. If it's not treated properly, that inflammation will persist over time and slowly start to damage the joint. When the joint gets damaged, that's what we call arthritis, and it's going to cause pain, it's going to cause dysfunction, it's just going to cause problems in general. So just like with arthritis, I mean, arthritis doesn't cause inflammation. These health problems don't cause inflammation. Inflammation is the cause of these health problems. It's the cause of the arthritis, okay? So treating the pain associated with arthritis is never going to fix the arthritis. You have to treat the underlying cause, and that's what the video is about. So just like a joint, if muscles get inflamed, it's going to cause spasming, it's going to cause tenderness, and it's going to cause trigger point formation. If the GI tract or if your gastrointestinal system gets inflamed, it's going to cause problems there. It's going to cause breakdown in the gastrointestinal tissues, both the walls and the membranes and everything associated with the gastrointestinal system. When these tissues become broken or damaged or break down, you're going to start to see problems with decreased absorption, nutrient deficiencies. It's going to cause problems like anemias, fatigue, all these other things, okay? As the tissues break down, you're going to see increased permeability. Remember, part of the job of the gastrointestinal tissues is to keep the toxins inside the intestines out of the body. Well, as the inflammation causes breakdown of those membranes and tissues, you're going to start to see increased permeability, which is going to lead to toxicity. The more toxins getting into the body, the sicker you're going to become, the more inflammation you're going to get and develop. And it's that inflammation that's going to cause the onset of more and more symptomatology and makes you feel worse. Another problem with inflammation of the gastrointestinal system is constipation and diarrhea, okay? Cramping and pain, okay? Abdominal cramping, abdominal pain, constipation, diarrhea is extremely debilitating. Ask anybody with irritable bowel syndrome, okay? It's horrible. It completely negates their ability to get out and function and do things spontaneously, okay? Inflammation can also affect neurons or nerves inside the body. If those nerves are inside the brain, one of the main things you're going to start to see are headaches, okay, migraines, things like that. If the inflammation is affecting the nerves in the body, you're going to start to see a breakdown of those nerves, which is going to cause not only pain, but it's going to cause tingling, pins and needles, numbness, ultimately weakness, and then more dysfunction, okay? That's what neuropathy is, okay? Peripheral neuropathy. Inflammation, like I said, inflammation of nerves causes those nerves to break down and deteriorate over time. If that inflammation is affecting the nerves or the neurons inside your brain, well, not only are you going to develop headaches and migraines, but you're also going to see a deterioration or a breakdown of those specific neurons. Neurons not only relay electrical impulses, but they're also responsible for manufacturing certain components associated with normal function, neurotransmitters, for example. So as these neuron pools begin to break down and die off, you're going to start to see an imbalance start to occur in the neurotransmitters. Serotonin, dopamine, epinephrine, norepinephrine, acetylcholine, GABA, All these things, these balances begin to become affected, and you develop these neurotransmitter imbalances. When neurotransmitters become imbalanced, that's when you're going to start to see the onset of symptomatology like depression, anxiety, panic attacks, insomnia, fatigue, lethargy or tiredness. You can see any combination of the above, okay? These symptoms are just the result, or the end result, of inflammation and breakdown of nerves in the brain. So, like I said, chronic inflammation is the real root cause of all chronic health problems. Anything from allergies and asthma to cancer, okay? So we're going to be discussing inflammation and how to fix it for the rest of the video. You see, one main thing that you need to understand is that your body will not heal as long as chronic or high levels of chronic inflammation are persistent, okay? Think of a diabetic. Diabetics are some of the most inflamed people on the planet, okay? That's why when they get a little nick or a cut on their foot, it's a big deal. The inflammation is going to prohibit their bodies from healing. Those little nicks and cuts and scrapes can then fester and get bigger and bigger because their body is not able to heal. And some of these little nicks and cuts can ultimately lead to amputation of the leg. So that's how bad inflammation is inside the body. Think of it like this. Get a fork and just to start to scrape or scratch the inside of your arm. Eventually that's going to create so much irritation and inflammation, the skin's going to start to come apart. It's going to start to bleed, and it's going to get pretty nasty pretty quick. I don't care how much Neosporin or Band-Aids you have and you start to put on, as long as you continue to scrape and irritate and scratch and cause inflammation, that tissue is not going to heal, no matter how much Neosporin you put on it. Inflammation is going to stop the healing process from occurring. So the first thing that needs to be done to heal this injury or heal this wound is to stop the inflammation, stop scratching it. Once you stop scratching it, the inflammation comes down, then you can start to use things like Neosporin and bandages to help that tissue heal quicker. But so long as you're scratching, it's not going to happen. You're not going to heal, okay? So, underlying message, inflammation is going to create damage to all the different tissues in the body, and that same inflammation is going to hinder the body's ability to naturally heal. That means you're going to experience more and more symptomatology as time goes on. You're just going to get sicker and sicker and sicker. So I hope that makes some sense. Stay tuned for the next part of the video.